Hello everyone watching this video around the world. Thank you for coming. I'm Dr. Faith from Korea, and I'm really greatly honored to participate in this case and present this remarkable concept to you. And also I'm thankful to be taking part in this project. So we are now broadcasting live at Samsung Dentium Center in Seoul. Today's online seminar will be helpful in a way that it provides experience and information that Dr. Young-Keun has developed so far. So the operator in this video is Dr. Young-Keun, who also he will be showing us the flapless technique surgery with his pin guide. So please feel free to leave a comment and ask question during this seminar. So today, I'm going to talk about the immediate implantation on anterior with minimalism, and also the small title is Flapless Surgery with NTI and pin guide. So today's patient is 73 years old male whose chief complaint is that his anterior teeth were broken by the accident. So past dental history as patient interview shows that he got implantation on tooth number 17, 36, 44, and 47. Fortunately, past medical history is confirmed as not specified NS. So here is now a panoramic X-ray saying that the patient got implants on tooth number 17, 36, and 3-unit implant supported bridge from 45 to 47. So there's not much bone loss observed on maxillary anterior teeth area due to the fact that root rests are still remained. And also we can see that the mandible shows moderate alveolar bone loss. And this is clinical photo of the patient. So this is our today's surgery plan. So surgery plan is to put the 2 implants on tooth number 12 and 21 immediately after extraction. So Dr. Young-Keun will be performing the bright tissue level implant flap surgery, and then he's gonna use his pin guide. And so this is a CT scan, and which is vertically sliced. And when you see the left image, it's the CT scan of number 12, and the right image is the CT scan of number 21. As I mentioned earlier, number 12 and 21 were broken, so we can see the root rest of both. And also at the end of root number 21, we can see periapical radiolucency, which indicates apical lesion. And so this is the picture with colored lines. So the yellow lines are referred as angulation of bone, whereas the red lines are referred as the direction of oriented tooth. Since the bone angulation and tooth direction are not parallel, Dr. Young-Keun made a decision to direct the drilling pathway to be angulated on palatal side. So implants will be placed in accordance of the direction of blue lines. So to put our current patient into context, I'm now going to discuss about the similar case with different patients so that we can see the similar process and injury. The patient in similar case is 54 years old, male, female, whose number 21 tooth was fractured. As history of dental treatment, the patient has had endodontic and crown treatment. I believe it is important to preserve the amount of alveolar bone following tooth extraction. The buccal bones of maxillary anterior teeth has a tendency to be thinner than lingual-sided bone, so it requires careful attention when extracting the anterior maxillary anterior teeth side. So this is the picture that straight angle pin is inserted on both buccally and lingually. The direction of pin indicates the inclination of maxillary anterior bone. So we can predict that the buccal side and lingual side are parallel. So in this picture, drilling was started before extracting tooth. A pilot drill and Lindman drill was used in a consecutive order. And here we can see the root rest, and this showing that the root rest was luxated, followed by 2.8 twist drilling. It makes extraction easier. And here we can see that the piece of root rest that was taken from the extraction socket. In this process, drilling was performed, so implant was performed for implant placement. An implant with appropriate length and diameter was selected. Direction of drilling should be inclined toward the bisecting lines of two pins. And panoramic view verifies the final installation of implants. And this is CT scan that confirms that the implant is successfully placed between two bone plates. And this is like a clinical photo, and so it's a photo of post-op. We can see that there's not much gingival recession involved in after version, and it clearly verifies that the flapless technique surgery is specialized for anterior teeth area. And now let's move on to the concept of pin guide surgery. So I'm going to explain the basic of the concept. So this is the overview of drilling and implantation. With the aid of two pins, it becomes way easier to predict the pathway of drilling and implantation. The key of pin guide system is to determine the bisecting lines of two pins, which leads to precisely executed implant positioning. And this simple diagram shows the process of pin guide surgery. So the first step is inserting pins. So that's the picture on the left, like a second left. And it is very essential that you have to put the pin right below the bone periosteum. And the pin should be slided onto the surface of bone. And I think it is very important that you feel the like a tactile sensation, and when you're doing with your hand. And once the pins are inserted, you need to find out the bisecting lines between two pins. Then when you find the bisecting line, you just need to follow through it as your drilling and implantation pathway. So this innovative pin guide system allows us to identify the shape of alveolar bone clearly. The good thing about pin guide is that it gives us the information of the bone width as well as bone shape. And these are the three types of insertion. So the left picture, it's showing that if pins are parallelly inserted, it indicates that the bone shape is more like linear. But when you see the picture in the middle, two pins are like close to each other. And that means it's a convergent pattern of bone shape. But the right image, you can see that the pins are like located apart from each other. So it's reverse of the previous version. So we can predict that it's a divergent shape of bone. So I guess he's using the holder and the pin holder and the pin. And the operator is marking the insertion spot with his marker, and that spot is right close to mucogingival junction, also known as MGJ. So the pin is inserted on tooth number 21 area. So now he's inserting, he's trying to marking the spot on the lingual side. So the lingual sided pins are like, they are more thinner and sharper. So that's that's quite different from the vocal pin. And also you need to make sure that the two pins are on the same line virtually. So CT scan is taken. So at this point, Dr. Young-Keun is using pilot drill in order to make burst hole. So it's switching to the twist 2.5 Lindland drill for more cutting action. And now it's a twist drill, which has a function to achieve the maximum drilling length. So he just take out the pins that he inserted. So now he's trying to use the elevator to look, say, the tooth out. And now he's trying to split the root rest into pieces. And the tool he was used is a chisel. And now palatal part was taken out. Then the vocal part was taken out very easily. And it's the same thing. So the later part is first. And then the vocal part, so the root rest were safely extracted. So now he's performing curettage to remove the granulation tissue. And irrigation is performed to clean any other remnants. And now he changed the angle of the lingual pin. So now it's 15 angled degree. So 15 angle degree pin is inserted on the lingual side. So now, I guess he's trying to drill on the bone, and it always starts with pilot drill as usual. And remember the concept that I told you before, that you have to follow the bisecting line as your drilling pathway. And this is the twist drill. And I guess it's the bigger size of the twist drill. So he's doing implant placement on tooth number 12. And he used the Dentium's bright tissue level implant. And the size is that 3.5 millimeter diameter and 11 millimeter length. And implantation on tooth number 21. And then, so basically it's the same as before. So 3.5 millimeter diameter and 11 millimeter length. So he's using ratchet to as a torque wrench to screw down the to tighten the screw down. And he just takes out all the pins he inserted. So now bone graft is being performed, and I assume that the material he's using now is osteon 3 from Dentium, and I think it has a lot of advantages since it has a wettability, which enables us to mold the graft. The graft material into the various shape. So I think it's a good product, and I highly recommend. And then the good thing about this product is that it's a mixed form of collagen and powder. So it is so it's very different from just the powder type. And then also Dentium just developed the new product of osteon Zeno, and this is very crucial product that it allows us. It's a so it's kind of xenograft. So it's so the right before I talked about the Zeno osteon Zeno, and which is very good for the all of the surgery because it is xenograft, and then it's basically the bovine ingredient. So it becomes to the alveolar bone naturally. So I guess he's now performing suture with blue nylon 5.0. And this nylon suture, it's very good for the flap closure because of elasticity and flexibility. And so I guess it makes the suture process easier. And also, I want to say that the bright tissue level implant, it has a lot of advantages, such as it has a minimal intervention around the peri implant, and also it's good for the using on narrow ridge. So bright tissue level is another recommendation for dentists. So he's finishing. So we'll have a short break, and we'll come back on Q&A session after 10 minutes of break. Thank you very much. And then Dr. Young-Keun have done a great work. So now we are back in the broadcasting room. So Dr. Young-Keun, you've done a great work today, and thank you for allowing us to use this patient as our case study.
Thank you. Dr. Wei, thank you for moderation. Yes, I say the result of today's operation. Yes, let's see the panorama X-ray and panorama after operation of surgery. Okay. This is the yes. Okay.
So this is the picture of insertion that yes. Inserted with our invented pin guy.
Okay.
And this is the CT scan of the pin insertion. So the left one is the tooth number 12, and then the right one is the tooth number 21. So we can clearly see that the pins are inserted on the lingually and buccally. And so this is the post-op of the panoramic X-ray. So so this is showing us that the implantation of the surgery site. So
yes.
yeah.
Yes. This is a city view and tooth number 12. And the bone is ideally positioned between the buccal plate and the ringo plate bone. Yes, nicely positioned. As you can see, it's good. Yes.
Yep.
Leg. This is tooth number 21. That's the city view. And I intentionally inclined to the palatal part slightly. By using the 15 angled pin, in the palatal side. So that's perfect. Yes. I like this position.
So, okay, so now at Q&A session, so the question, so the question we have is the purpose of the drilling on the tooth before extracting it. So, how do you think about the question?
Oh, yes, good. Nice question. It's a good question. Thank you for the good question. But my answer is to say directly, drilling makes extraction easier. To make it easier and to make extraction easier and safer, we needed to split the root before extraction. However, it is not easy to root split right away. So, if we drill the root and make a hole first, we can split the root more easily. But the direction of drilling can be critical and as well as important because the direction of drilling is constant with the direction of implant placement. Fortunately, pin guide can have decision the direction. That's all.
So that's very understandable. So that's very clear explanation. So thank you for seeing the surgery. And we'll have another live surgery on May 6th. So I hope to see you soon. Take care. Bye.